Well, I hope everybody's doing great. Happy Friday. Feels like August outside in Columbia, South Carolina, but it is South Carolina in the summertime. Um, it is 9 o'clock, so we're going to do this thing. Welcome. It's another interesting week. I'm running out of adjectives, quite frankly, describing 2020. If y'all have some advice on that, maybe we can start a Twitter feed on that of ways to describe 2020 that we didn't think we could ever do. So we've had an interesting couple of weeks, and a lot of it has to deal with the recurrence of, or the upward tick of cases we've had of COVID and how it's impacting the business community here in Columbia and everything. I mean, I was talking to somebody this morning and said, you know what? I don't know what the new normal is, and we keep asking ourselves what the new normal is, but I just want some consistency. Maybe that's what my life is missing right now is consistency. So one day we'll get it. So the elephant in the room, and Dr. Witherspoon is on. I mean, it was such an interesting press conference this week talking about schools, and we've had a lot of discussion over that last couple of weeks and how we prepare to get our kids back to school. A lot of districts have gone down a path of going one way, then the governor comes out and says, hey, we're not going to mandate it, but I'm highly encouraging, which I highly encourage my kids all the time. I don't know encouragement or what the carrot stick is. I'm not quite sure what his motivation or what he's trying to do there. I don't know if anybody does, Dr. Witherspoon, so I'm not going to put you on the spot and ask you what you think that is, but I do think there's some, if you look at the whole argument, nobody's wrong. I think there's a lot of different options out there, and there's no good answers. So we're going to do the best we can. I know Dr. Witherspoon and his board are doing the same, and many districts around the state are doing it, but by the number of folks that tuned in to that conversation and continue to tune in to the conversation, it is a hot topic, to say the least, and one that we're waiting very closely on. But as we think about schools opening up, and we still had an upward tick this week, such an anomaly yesterday because they didn't report any COVID deaths in South Carolina on Wednesday. Yesterday, we showed a record number 69, but that was a compilation of the last couple of weeks where people undetermined cause of death. But so that's still frightening. But I'll have to tell you, the hits keep on coming. I was a little put out yesterday with the Greek festival getting canceled. That hurts. But like everything else, it'll come back stronger. But I was kind of looking forward to some more good Greek food. Interesting numbers coming out of the state this week on hotel occupancy. Third straight week of drops. Last week we were at 52% hotel occupancy. That was down to 48% this week. And so what does that say? It says the negative press has made an impact, as being a, what do we call those, hot state right now of COVID cases, the national attention of that, as well as, just people paying attention, people being concerned, it's just taking a hit. What is phenomenal is through, I may have mentioned this on another call, but what we're seeing in hotels as well as airlines, where Charlotte Douglas has historically been a business traveler, it is now recreational travel or families that are traveling, seeing relatives they haven't been able to see in a while, but it's not your normal business travel. So every marketplace has seen some inversion, if you will, of business, whether it's eat in to take out, whether it's online versus in person, to the hotels and to the airlines that are seeing less business travel and more recreational travel. The other thing, and I can't really share the screen, I'm sorry, but I was reading some stuff yesterday. We've got a bunch of earning calls this week and next week, and all the folks on Wall Street are really taking a look at what's going on. there was a semi-annual release of health companies' GDP, and it was really interesting to see the top gainers in the health arena. And I'll read them off to you. The biggest gains: Nant Health, Livongo, One Medical, Teladoc, Invitae, Peloton, and Viva. I don't know these companies. I know like 3 of them, but Peloton obviously is a workout company, but they're seen in the healthcare arena. One Medical, which our old friend John Singerling now works for, has in the last 6 months has seen a 159% gain in their portfolio or their value, which is significant. Teladoc is up 130%. That's huge numbers in a short period of time. But it just shows you that a couple things. One, in this marketplace, what's really going to take off is the technology field, and which is more reason why we've got to look to Congress as well as to the state of South Carolina to really invest in broadband, because those 2 companies deal with electronic or medical technology. And to see those types of returns in a short period of time is really phenomenal. But it absolutely has the ability to transform education as well. And I know the state of South Carolina has spent $50 million to come up with a solution for this fall. And I think they're called MiFi, the little hotspots for kids to get technology or internet access to their homes, those that don't have it. And so that's an important resource, I think, that is not a perfect situation long term, but it's certainly a strategy for the short term that I think could really benefit. So I always call them hotspots. I was not familiar with the term MiFi. I think that's saying that right. But anyway, hopefully those will be deployed in the next few weeks. And one thing I will say about the governor's recommendations, and this will be the last thing I say, I'll leave it up to y'all, but I do think pushing them back past Labor Day is not a bad option. It gives a little bit more time for everybody to think strategically, and it allows the virus to take its course for a few more weeks, at least 3 more weeks earlier or later than what was intended. So and we'll come back to that. Anyway, so MiFi and broadband are big issues, and we are trying to work with Clyburn again to see if he can come on and let's talk a little bit about the broadband. There's a lot going on right now behind the scenes and lots of conversations, and quite frankly, South Carolina is going to be a huge beneficiary because 1, we've been talking about it for a while. 2, Clyburn's been talking about it as a huge passion for him. So I think companies that specialize in these programming or this types of broadband, internet capacity issues, they're going to take off here in South Carolina. We're a very, very small state, so to see a large number of people impacted is more cost effective here than other states. So I'm very, very hopeful that we're going to see some announcements in this quarter, quite frankly, on some broadband initiatives across the state. So that's good stuff. Interesting article today about some winners and losers of COVID, and some small businesses are still taking hits. I talk to them every single day. We've got businesses, I think they were quoted, some restaurants in Lexington that are doing extremely well that were able to pivot to. But I am sorry, Martha Studsill, who owns Uptown Gifts, is closing, and she and I have talked extensively since COVID has started, and we hate to lose Martha because of 1, she's just a great lady. 2, she runs a good business, and we hate to see that close up. But her rationale is solid and sound, and she's going to spend a lot more time with grandkids, which I think that makes it a lot more palatable for her. But we hate to see it, but we are going to see a few more of those. This CARES Act winds down. It's set to expire July 25th. PPP dollars, those that have and we're seeing a lot more data coming out about PPP and who's been able to receive it. But those dollars, you had 12 to 24 weeks to spend those dollars, and those that are, we're going to see what happens when the funds do run out there. But I am cautious in the next few weeks on what we see, and very, very disappointed in our congressional leadership, not just in South Carolina, but as a whole, that we have the worst pandemic we've seen in the United States, I guess, since the Spanish flu. And there's a lot of uncertainty, and quite frankly, the politics has taken over, obviously. But to not have a response, and will not have a response till mid-August on a CARES Act that runs out in July, I don't get it. So anyway, if you talk to your congressional folks, give them hell for me. They need to hear it. We need some answers, and from a small business level to making sure that we take care of our employees. There's a lot on everybody's minds, and so I'm frustrated. I'm sure many of y'all are. All right, what else is going on? I know there's some conversations that y'all are having that y'all want to share with us. Anything that we need to be doing? We're still pushing out our pledges, and so if y'all have not signed the pledge to open up responsibly, please do that. I know a lot of companies in the last 2 weeks have pushed back their opening dates, which I totally get, understandable, and makes sense. I will say one last note that the General Assembly had a hearing on, I think it may have been yesterday, on liability protection for businesses. Thank you for the General Assembly of having those meetings. I know we've been critical of them for not having that. They've done it. They're coming back in September. We hope that they will take that measure up as a whole entire body. But it is, all we're asking, by the way, is if a company performs and they have taken every necessary, in their minds, precautions, and they're not doing anything, they're doing their darndest to do the right thing, they shouldn't be held liable for somebody getting COVID, because there's not a great way to protect everybody. But this is not liability insurance for somebody to be careless. It is to, if you're acting responsible and are performing the best way you can, that a lot of frivolous lawsuits are going to happen, and we just, the threat of one lawsuit can shut down a business, and that's the scary thing. So so we'll keep pushing on that as well. One interesting tidbit, and I was not familiar with this until yesterday, but one of the state laws that, July 1, everything kind of takes over. July 1 or January 1, new laws take into effect, or some sunset. And one that was a sunset as of July 1st was the statute governing nonprofit raffles. So if y'all have a nonprofit, whether it's a food bank or a chamber or a Rotary Club, no more raffles. You're not protected by the state to have those raffles for whatever reason. Chuck.
Hey, good morning. I just want to go back to the conversation that you were having about broadband, and wanted to share a site with the group, and some may be familiar with it. It's the Digital Divide Index that was authored by the Purdue Center for Regional Development. And that website is pcrd.edu. And what that site does is you can go in and take a look at Richland County, for example, and it will highlight what areas of the county has a divide. The rankings from 0 to, I think it's 100 are the rankings, and then they're also color-coded. The lighter shades indicate that there is minimal divide, and the areas that are darker shaded has a significant divide. So if the chamber is curious about where the divides might be, across, its footprint, that'd be a great place to start.
Hey, will you do me a favor?
Yes.
Put
it in the chat?
Yes.
Email.
that would help if you don't mind, so we can check that website out. It's good information to have. And the folks I've been talking to in this space, it really is, we have a unique opportunity in South Carolina to really close that divide. And again, we're a small state geographically speaking. And so we can get a lot more people introduced to broadband. It's more cost effective here in South Carolina than anywhere else. And plus we've got the leadership that stepped up in Clyburn and Luke Kennedy and others that have really been pushing this the last few years. So I am very, very excited. And that is, I mean, for a large number of people, it's a game changer, and have access to the internet. And when I mentioned the MiFi and other little hotspots, I mean, they're great to read and to do things, but they don't have high capacity. So you're not going to be able to do a ton of Zoom calls on a little hotspot thing, but they do work for a short period of time, and they can get people. I mean, how many kids have we heard about are sitting on a bus doing work, or buses are having to sit in parking lots to give people access to Wi-Fi. Anyway, it's a much needed investment in the state, not just our community, because it's not just the PD, it's Lower Richland, it's western part of the county, it's all over, but it's big pockets. And so I actually look forward to sitting down and reviewing this Purdue Center. So thanks for sharing it, Chuck. Any other comments on that? Okay. How about anything else going on? I swore I wasn't going to do this, but I'm happy to call people out and get thoughts on stuff. So if you have an idea or you've got something that you want to talk about, floor is yours.
Hey, Carl.
Yes.
This is Randy Halfake over in
Mr.
Lexington.
President.
How are you, sir?
I'm great. Hope you are.
I'm doing great. Question, it appears to be total different communities in terms of mask wearing. I've noticed in Columbia, and I know y'all have a ordinance over there to require masks. In Lexington, we have kind of a hodgepodge. Some require, some don't. The Lexington County Council seems to have no interest in it. Does Columbia have any metrics as to what positive results, possibly from wearing the mask for the last, month and a half?
The mask's been in effect. Somebody help me out. Is it 2 weeks?
I was thinking it was longer than that in Columbia.
I think it's only been 2 weeks.
Okay. So probably you really don't have any valid information as to what positive impact it may have in terms of trying to mitigate the virus spread.
So what is truly interesting is seeing the charts of cases, and you look at 10 days to 14 days after an event. So you look at 10 to 14 days after Memorial Day.
Right.
You look at 10 to 14 days after July 4th is where we are right now. I mean, we're in that window, and we've seen spikes over spikes over spikes. And so we just can't control it. Now, interesting, I understand there's limited, the governor's powers are somewhat limited. They are far broader during an emergency, but pot shots at different businesses. I mean, I've talked to a lot of bar owners this week who were beyond frustrated and mad that the governor shut down liquor sales after 11 o'clock. Seems somewhat arbitrary in some ways. A beer is good at 10, but it's not good at 11. I don't know the science behind that, or if there is science or data to support it, but I've not seen it yet. But we've not slowed down, so I think it's going to take at least 2 weeks to see any data form from any of these decisions. And so, Randy, that's a good question and a very legit question. But I think it's going to have to see, the CDC said this week it's going to take at least 1 month, probably 2 months of unified mask wearing to really contain the virus. But when pockets or people are not doing it, and a lot more stores and have said required masks, even the Target and Publix, and they're requiring it all their stores now. We talked about this about 6 weeks ago when Costco was the first company to do it. So even though local jurisdictions aren't requiring it, stores are requiring it. And I'm not a legal scholar by any stretch of imagination, but I am captivated by what's going on in Georgia. It's like Georgia's to South Carolina, hold my beer. I got this. And it's the governor suing the city of Atlanta for putting in a mask ordinance.
I don't get it either, Carl. It doesn't make any rational sense.
Anyway, that's why I think so much. I can't wait till November 4th. I'm over the election. I'm over all this, but the politics has got to go away, and we need to make solid decisions about, one, protecting the healthcare and our community, but two, we got to look out for businesses as well. We got to make sure that the economy stays as strong as possible and people can work, and it's a balance. And that's what we're hoping to find, is a balance, which I mentioned, right answers, wrong answers. Everybody's got opinions. Let's just put them in check and let's figure out the best possible way forward. All right, I'll get off my soapbox now. Yes, sir.
Let me just make a follow-up comment to that. It's as a former elected official, it's intriguing to me to see the private sector like Walmart, Kohl's, even Dollar General, and many of the others, Best Buy, step up and require masks in their stores, not only from their employees, but also for the general public. They're pretty much taking over the basic role of government, and that is to protect the health, safety, and welfare of its citizens. And some pockets over in Lexington have kind of abdicated that. So I just find that intriguing. Well, I won't say anymore because I don't want to get myself in trouble here, but I just find it all so intriguing.
In fairness, private businesses, the private sector can move a lot quicker, and they respond, and they have resources to do things that the public sector, it does take a little while to do. Businesses have been stepping up for years to lead, and so I think they'll continue to do so. But they also recognize that in order for you to continue to see customers walk through your doors, you're going to have to make sure that consumer confidence is high enough, and they're putting their safety above anything else. And so it's as much as the right thing to do, but it's a business decision to say, hey, we are going to take care of our customers, our employees, and we've got to go a little further to prove that we are ready to earn your business. And so if you're not doing that, which is why we put the pledge signs up, and why Lexington Chamber is doing it, while we're doing it, is to give people the confidence to get back to the public and get back in and shop and keep the economy moving. It's vitally important. So thanks for your comments.
Agree. Thank you.
Anybody else got some comments today?
Carl, this is Lynn. Good morning, everybody.
Good morning, Lynn.
How are you?
Great. Hope you are.
Well, I was just going to say that, and just to add to what you all are talking about, it affects their bottom line. The other thing, they have to convince their employees that they're taking every step that they can to protect their employees in order to keep them coming to work every day. That's
exactly right. Which is interesting. I think if from a company's perspective, if the innovation from the private sector has led to the shields that we see at every checkout counter, the mask wearing, I love the Z shields that are made here in Columbia that give a lot of protection to folks. I think the reusable face shields are great. And so if you've got interaction with the public, those are good investments by companies to make to give their employees a little added comfort, I mean, you look at hospitals and folks say, well, hospitals have all this PPE. Well, hospitals only wearing the same mask that we all see. And if they're dealing with COVID patients, they have to put on some gloves and all that stuff. But if you're not dealing with a COVID patient and you work in a hospital setting, the only thing you've got is the same mask that everybody else is wearing. And so, but there's a perception and there's a level of comfort that they're in a better position. So it's making sure that your employees and your customers feel like you're taking all the necessary steps. But you got to go over above and beyond right now. How about any other thoughts today on this cool Friday morning? Okay. Well, we're going to be working on some things next week. We got a lot of big projects. I'm not ready to tell you about some of the things we've been working on, but a lot of community-wide projects that the Chamber's working with other groups on that we'll be talking about real soon. And I look forward to sharing that. I want to make sure y'all recognize we're still working hard. If you haven't signed up for the pledge, we ask you to do that. If you hear anything going on that we need to be aware of, please let us know. We're looking at some options as well, other than this type of medium, but trying to get small businesses back to a level of engagement. And even though we can't do things in person right now, I still call them after hours, but partner engagements and stuff, we're looking at restarting those maybe in a virtual setting. And we've been trying different things out just to see if it works. So we're going to roll those out here soon. I know July is a slow month, everybody taking a little bit of time off. So we're going to gear back up here in the next couple of weeks. So I really appreciate everybody being with us today. I hope y'all have a long, nice, enjoyable weekend sweating. And we look forward to being back here with you next Friday. So y'all have a good week. And thanks for tuning in. We appreciate it. Have a good one.
This well, my friend. Take care.
See you.
Bye-bye.